All right, good afternoon. Hello, everyone, and welcome to the Women and Girls Foundation's new web show, In the Movement. I'm your host, Camila Rivera-Tinsley, and each month we will be interviewing incredible people who are working towards creating a more sustainable and equitable future with conversations that are focused on gender, racial, and environmental justice. And this month, I am joined by Sydney Etheredge, who is the CEO of Planned Parenthood of Western PA. And we're going to be discussing a lot of different topics that are pertaining to women's health. And I'm really excited to dive into this conversation and really learn more from you, Sydney. So, welcome to the web show. It's so wonderful to have you here. Tell us a little bit about yourself and tell us about your role at Planned Parenthood.
Well, thank you so much for having me. I feel very excited. I'm assuming that I'm the first guest of the new year. So, yay, that's exciting. And really happy to have this conversation, obviously, given all that's coming up in 2024 and beyond. Yeah, so I am the president and CEO of Planned Parenthood of Western Pennsylvania. Planned Parenthood of Western Pennsylvania has been around for over 90 years in the region and provides sexual and reproductive health care services, education, and advocacy work all across the 29 counties of Western PA. I stepped into this role in January of 2022, so just a few months before the Supreme Court leak, and then obviously the overturning of Roe versus Wade that summer. So I really like to say that I hit the ground running. But this space, sexual and reproductive health care, reproductive justice, a lot of this work is something that I had been doing because prior to coming to Planned Parenthood of Western Pennsylvania, I spent 1 month shy of 10 years at the Planned Parenthood National Office in Washington, D.C., doing a lot of this work at a national level and working with affiliates across the country on a lot of the issues that we're working on here in Western PA.
That's fantastic. I mean, you have had such a storied career and such an investment, a huge part of your life invested in making sure that women have access to healthcare and, in particular, reproductive justice. And that's why we're so happy to have you here because WGF, the Women and Girls Foundation, we also align with those same causes and those same values. And so, can you discuss the impact of the fall of Roe, both nationally and here in Pennsylvania?
Yeah, of course. I mean, the biggest thing that happened when Roe fell was that we lost the federal protection to abortion rights. And so basically, what that means is that the federal law no longer provided the floor for abortion rights, which allowed abortion. In some cases, I think when we think about Roe, it's really important that we remember that it was the floor, not the ceiling. Because even though we had Roe, we still would see states like our own here in Pennsylvania pass very specific targeted restriction on abortion care towards providers. And we saw other states have gestational limits and things like that. But when Roe fell, we lost that protection federally, and then we really started to see a cascade of states passing laws that were impacting abortion rights. And so some of those that we saw were incredibly harmful. Like we almost immediately saw bans in states like Ohio and a number of states down south, or we saw bans where they were really strict with the gestational limit. So you couldn't allow an abortion after 6 weeks of pregnancy. And I think for a lot of us who have periods, we understand that that 6 week window is a very small window of time to both confirm and then make the decision and then actually seek and access abortion care. And so we started to see states really take these aggressive bans and restrictions on abortion rights, which they were now able to do because there was not the federal protection to abortion with Roe falling. But then we also saw that activate some states to codify abortion rights in their state constitution and in their state law. And so we saw that in places like Michigan and in other places where they really wanted to make sure that access to abortion care would be a standard for people in their state. Again, when we say access to abortion care, that can be a very gray space. It can we can still see restrictions and we can still see targeted policies that restrict that access, but there is at least some level of protection in some of those states that patients can access abortion care and doctors can provide that care. So that's really thinking about how that impacts the patient nationally. So like where can they get access? But we also started to see a very dynamic legal environment when it came to providers and how they can access care. or how they can provide care. And I think we see that a lot, and probably the most unfortunate place and the unfortunate stories are in places like Texas, where we are seeing, because of the abortion restrictions in Texas, we are starting to see providers not be able to or not feel comfortable providing miscarriage management for patients, because that type of care can be is so similar to just abortion care, that providers don't even want to get into that space because their medical license is at risk, or they could be prosecuted, thrown in jail. We're seeing women who are trying to seek this type of care getting having to go in front of courts and in front of juries talking about a miscarriage or these things. And so it created just an incredibly scary environment for both patient and providers alike. And it has really created a very unique legal environment, one that we had never been in, both because not only, like, obviously we hadn't had Roe forever. So there was a period when we didn't have that protection, but we have also seen so much about medicine advance to where we are now, particularly with things like medication abortion, that we're just in a really unique space and we're all trying to really figure that out. And so, what does that mean for Pennsylvania? Because we have a governor and that is very committed to access to sexual and reproductive health care and abortion care, we are able to still provide abortion here in Pennsylvania. So here in Western PA, we can provide that care. But as I had mentioned, even with Roe, we were seeing a lot of continued attacks on abortion care in the state. And so across the entire state of Pennsylvania, there are only about 19 abortion providers. Two of those are west of Harrisburg and in Allegheny County, us and our partners at Allegheny Repro. And so while we have access to abortion care in Pennsylvania, two providers for the entire west side of the state is not access. So that's when I say things like, oh yeah, it's codified in the Constitution for a state so that people have access. Really, what is access? And that's something a lot of us in the reproductive rights and the reproductive justice movement are really trying to talk about. Just having a policy or allowing abortion does not mean access for everyone, and that's something that we really need to work on, and Roe definitely did not address.
Oh my goodness. Just thinking about that, two centers for the whole western half of the state blows my mind. And I'm sure it's going to blow the mind of many of our viewers. So that pressure that we have, as you said, we have our rights codified, so to speak, but there's an incredible amount of pressure for actual access on the western half of the state. And thinking about some of the other states that maybe don't have the robust, and I'm going to use that word lightly, robust access that Pennsylvania has. So is Planned Parenthood seeing an uptick in patients coming from out of state to access abortion care? And what type of pressure does that put on the two centers that are available on this side of the state?
Yeah, I mean, I can say, you know, when Roe fell, I think we all thought that Ohio had about 6 months before they would go dark on abortion care, and it was about 6 hours that they acted very quickly and put in a restriction, which then almost immediately we saw increased calls, increased requests for visits from patients both in Pennsylvania and Ohio, seeking care right after the fall of Roe. You know, we definitely at Planned Parenthood of Western Pennsylvania and our partners at Allegheny Repro have been really focused on how we can expand access, knowing that there are only two of us in the region providing independent freestanding abortion clinics providing this type of care. And so a lot of work has been done to open up access. So there have been obviously an increase in the demand for abortion services, and we have really been trying to meet that moment. And with that demand, not only are we seeing patients, because again, we are servicing a big chunk of the state of Pennsylvania, and we're seeing patients coming from all over, up from Erie, further east, but we also did see an increase in our number of patients that were coming out of state. So before Roe, about 15, 16% of our patients who are abortion care were from out of state, and they were kind of from the usual actors. So Ohio, West Virginia, Kentucky, places with really restrictive abortion access that have always been restrictive. After the fall of Roe, now about a quarter of our abortion patients come from out of state, and they're coming from as far south and west as Texas. So we know that we are doing the work to make sure that there is access here, and because of that, we are just seeing patients coming both from Pennsylvania and other places as well. And I do just want to say, we in Pennsylvania have not codified abortion rights in our Constitution. Again, the only reason that we are able to provide care is because we have a governor that would veto anything that came forward. But also, we do know that prior to the changing of the legislature, we almost had a constitutional amendment which would have banned abortion and funding for abortion in Pennsylvania. And so we are kind of always on the cusp here in Pennsylvania of becoming like in Ohio or one of these restrictive states. And so since we don't have that protection in our Constitution, it is always something that's top of mind for us, our staff, and our patients.
Thank you for reiterating that and correcting my misinformation. And I'll just take this time to plug the fact that we should all be registering to vote, and making sure that we are paying attention to those local elections and to those elections that are not the big federal elections that are coming up that we all seem to be keyed into. So important to make sure that we are using our voices, because our health and our longevity is literally at stake here. So I have some more follow-up questions. One that I think is important to let people know is, why is abortion care considered essential health care?
Yeah, I think it's important for people to know, as long as we know people have been able to get pregnant, uh, abortion has been something that has also existed. So it is important to know that that is part of comprehensive sexual and reproductive health care for people who can reproduce in this country. The American College of Obstetricians and Gynecologists also firmly believe this and state that abortion is a part of the continuum of comprehensive sexual and reproductive health care for women and people with uteruses in this country. And it is incredibly important then that people have access to this life-saving type of care. As I had mentioned earlier, I think we're really starting to see now kind of that very thin line between miscarriage management and abortion care, and how now when we're seeing a lot of these restrictions and we're seeing these things happen that put in place around abortion care, it's also harming patients that are miscarrying, whether that's miscarrying naturally, because how you manage a miscarriage can be very similar to how you provide abortion as well. And so I think that's something that sometimes gets lost in the conversation, that not only is abortion access and abortion care essential health care, but as we start putting in these limits and we start putting in these policies and these restrictions, it isn't just harming people who are um, looking to receive an abortion, it's also harming people who are miscarrying. And that is really all a part of just the bigger issue that we are seeing that really ties into kind of the shame and the stigma that's placed around both abortion care, miscarriages, and just sexual and reproductive health care more broadly. And I think, as we sit here as two women, I'm sure we can probably talk about that shame that we feel even with just like when we get our periods, and how much of that is put on women and people with uteruses and people who can reproduce, and how hard that is. And now we're really seeing how all of that is really starting to not just harm us both personally and emotionally, but the actual well-being of women and people who can reproduce in this country, as we're hearing about women having to wait to until they're in sepsis or they're bleeding out to get abortion care or miscarriage management care. And so it is really just this, it is a really scary place to be in for a type of care that has been around for centuries, and when done in the appropriate setting is incredibly safe and incredibly effective.
So speaking of that, can we discuss, and please correct me if I mispronounce it, mifepristone? Did I say that correctly?
Mifepristone, yes.
We discuss mifepristone, which is the abortion pill, and why that's under fire right now.
Yeah, I think this is a really important topic, and probably a lot of people are hearing about this and are just like, what is mifepristone? And so mifepristone is one of the two drugs that are used in a medication abortion protocol. So, for those of you who don't know, medication abortion is a very common type of abortion. About half of abortions are done through medication. So instead of having a procedure, you ingest two different types of medication, mifepristone and misoprostol, and under a certain number of weeks, and then your body will go through the process of having an abortion. So that basically allows someone to go through this in a more private setting or at home in a more comfortable space and not having to be in a clinic. This is Mifepristone is an incredibly safe drug. It's been approved by the FDA for over 20 years. It is the kind of highest standard of medication abortion protocol is to use mifepristone and misoprostol, and it has been around for a very long time. Recently, there was a court case that was filed in Texas with a federal judge that basically questioned the FDA's approval of mifepristone. And so basically, they wanted to invalidate the FDA approval and say that it should not have been approved for a whole host of different reasons. None of those reasons which were actually medically accurate, but really trying to remove the drug off the market. And so this case has been moving through federal courts, and recently the Supreme Court announced that it will take up this case. And so it's important for people to know that while the Supreme Court is taking up this case, essentially what they will be deciding on is not if they're going to remove mifepristone from the market, because a Fifth Circuit basically said that's not up for continued legal review. But there are certain FDA approvals that made mifepristone easier to access that the court is now going to be looking into. So if the court goes against this and kind of go sides against the drug of mifepristone, there's going to be a rollback in how providers and patients can access it, which will make it harder for patients to access the drug. And so while this is incredibly concerning because it impacts a very safe and effective way of terminating a pregnancy, one of the kind of the bigger thing here too is that this is also attacking the FDA, which can have really, so this not only has really big ramifications for sexual and reproductive health care and access to care and services, but it also can open the floodgates on approval of FDA drugs and other FDA drugs that people just maybe don't agree with or don't like and then want to take up these cases. And so it's putting us, I think, on a really slippery slope that is incredibly scary, because I think if you ask most people would say the FDA has been like an overall net good, and we want to trust these decisions to those who are scientists, who have been doing this work, who really know how to move a drug through a process like this, and not some judge in Texas. And that's basically how this has been working. And now it's going to be in front of the Supreme Court. And so there is just kind of a lot at stake in this ruling that will be coming out most likely in the summer. And so it is really important that, if people are interested in sexual and reproductive health care and this topic and reproductive justice, really to follow this case and what happens, because it could really tell where we're going to be fighting in the work we're going to have ahead of us in the future.
So, in a very, very bleak future, in the event that mifepristone actually does become illegal, what do you anticipate the response of Planned Parenthood of Western PA? What will be your response?
Yeah, so we do know that you can provide medication abortion care through a misoprostol only protocol. That's something that has been happening in Europe for a very long time. And so it is something that we are prepared to do if mifepristone were to be pulled off the shelves. But we know since that most likely won't happen at this time, we are really taking a look at our workflows and practices to make sure they align with kind of the rollback of how people would access care, and trying to make it as easy as possible for patients to continue to be provided mifepristone as a part of their medication abortion visit, while knowing that it could change just some of like the prescribing and the FDA approval and what can be done with the drug. And so we are really keeping an eye on that in partnership with our legal partners here and our national office of Planned Parenthood.
So discuss access to care, especially for people of color and working class folks. I know you mentioned earlier in our discussion, you're seeing an uptick in people traveling from as far as Texas. And I think about how much that costs for folks, right? So right there, if you have to travel, it means that you're going to need to have access to some resources. So do you want to talk a little bit more about that?
Yeah, I think what's really important, and I think the issue of abortion care is obviously so important, and we should be talking about it all the time because we need to really uplift what is at stake here. I think a lot of people don't realize when we see restrictions like this on abortion care, there's just an increased demand in family planning as well. And we have 7 health centers across the Western Pennsylvania region, and only one of them provides abortion care. The rest provide family planning services. And so we've also seen patients really interested in talking about their contraceptive options, thinking about potentially a more reliable form than the pill, looking into things like depot shots or an IUD, just so they, are doing what they can to make sure they are not in a situation where they may need to get an abortion, and then whether because they're in school or they move, they're in a state where they can't access abortion care. And so I think particularly, when we're thinking about some of our more rural communities, since we do cover Western Pennsylvania, we do have our urban areas and our cities, but we also have a large rural population. Not only are they seeing a decrease in abortion providers because we know the only 2 freestanding clinics are in the city of Pittsburgh, they're also seeing, it's harder to get access to just sexual and reproductive health care, an OBGYN visit, their annual pap smear, things like that. We also are seeing across the country and here in our state of Pennsylvania, it's getting harder to find quality maternal health care. And so people you can go to if you are pregnant or wanting to get pregnant. And that really does compound for rural communities. That compounds for communities who don't have access to maybe insurance like some people do, or if they're on Medicaid, it can be harder to find these types of providers. We know a lot of our LGBTQ plus patients, it's hard to find care that's non-judgmental in some of these spaces as well. And so it's kind of just like a powder keg for some of these more marginalized communities, which we know have had historically barriers to accessing care. And then when we see these restrictions, it just makes it even harder for them to find even just the basic care, just like an annual pap smear or just like a wellness check. And so it really is something that we as a provider in these areas think about. How are we making sure that we are, doing things and keeping things like telehealth? We launched telehealth in COVID for people if they want to meet with a provider to talk about their family planning visit or about their birth control option. So making sure that we're continuing to provide telehealth services so we can link our most rural communities or even those right downtown in the city of Pittsburgh who just like can't leave work or can't, find childcare to catch a bus or to drive downtown to go in for their visit. So really making sure that we're thinking about what we can be doing as a provider during these times while we're continuing to fight to expand and to provide abortion care, but how are we also bolstering family planning care and sexual and reproductive health care more broadly, because we just know that that type of care has been so hard for people to access for so long. And we want to make sure that when these fights are happening, they're happening together because the same person that is seeking contraceptives could be the same person that is seeking abortion care, can be the same person that's seeking maternal health care or maternity care because they are pregnant and want to carry that pregnancy and build their family. So, like, we are all seeing the same patients. And so, really thinking about this as a continuum for anyone who needs to access the care is incredibly important.
Thank you so much for speaking to that very, very complex access issue because it is filled with complexities. And at the end of the day, I think, what you said really hits home is that what we really care about and what WGF cares about is making sure that women have healthy futures and they have access to everything that everyone else has access to. And
Mhm.
that includes bodily autonomy, and it
Yep.
includes having a sense of longevity and a healthy life. And so I'm so glad to be able to have you on to speak about these issues. You've shared so much with us today. As we wrap up, is there anything else that you want to share about Planned Parenthood of Western Pennsylvania, or just about women's health, or anything that you want to share with us?
Yeah, I mean, I always say sometimes I'll be on these and I'm like, I feel like I'm such a downer. Or I'm talking about all these like really heavy, big issues that can feel so bad. Like just there's no other way to explain it. Like just like so bleak. But I will say, I think there is just so much movement. There is just so much, the depth of understanding about how these issues intersect has gotten so deep in the past few years that I think it is activating people in a way that we've never really seen before, particularly our young people. So when I think of Women and Girls Foundation, I really think about the G in that and girls and how activated they are on these issues. And that is really, like why I continue to wake up and like do this work. And one of the reasons why I took this job was to show younger people, particularly young women, young people of color, young people from marginalized communities, that there is a space in this movement for them. And that is how these movements will grow and continue to evolve and meet the needs of our next generations. And so I think that I hope I can say that and people can feel somewhat hopeful as someone who gets to be in a lot of these spaces and meet with people like that is really a driver. And so working with you and your team and getting to be a link to so many of these communities in our region is really important and is what is going to be driving this moving forward. So I feel really excited about that. And I hope people listening to this feel excited too, because we all need a little bit of excitement to start a new year. But we are always excited to engage with people. And so if people are interested in learning more about Planned Parenthood of Western Pennsylvania, they can follow us on social media. You can go to our website at ppwp.org and you can subscribe to our newsletter. You can also donate. You can also sign up if you want to volunteer. We have a lot of volunteer positions and work that we can be doing if people want to get engaged that way. But if anything, if they just want to see what we're up to, they can sign up for a newsletter, get something from us monthly, see what's going on and how they can stay engaged in our work. And also in that newsletter, we uplift a lot of our partners too. So I'm sure they'll see things that you all are doing as well and others in the region.
So I just want to wrap us up by encouraging people to please go and visit Planned Parenthood's website so that you can give back and you can support a wonderful organization. And I'll also take this time to plug, please support the Women and Girls Foundation. You can come and find us at wgfpa.org, sign up for our newsletter, and help us to amplify voices and causes like Sydney Etheredge and Planned Parenthood of Western PA. Really looking forward to working with you throughout the rest of this year and making sure that we can do everything that we can to make sure that women and girls have a really bright, great future.
Thank you. Can't wait.